Hi everyone, my name is Dr. Armid. I'm from Dr. McQ. A lot of my patients come to me and say, Doctor, I want a full body checkup, or can you do blood tests to check for cancer? Unfortunately, we can't do a blood test that will pick up all kinds of cancers. So we tend to look at your symptoms and your age, as well as your risk factors to kind of guide you into what tests you need to do specifically to pick up cancers, but other chronic diseases. So today's topic, being November as well, is going to focus specifically on men's health screening. What tests should you do and when? So, in this specific topic, we look at two age categories. The first one is 19 to 39 years of age, when you're in your sort of most fit years. What are your things that you need to be doing? And then in 40 to 64 years of age, your sort of later years in life, when you're still feeling young, what are the tests that you need to be doing? So, if we start at 19 to 39, now, in general, if you've been diagnosed as having a disease, your doctor will tell you how often you need to come for checkups. But this is assuming you don't have any chronic illnesses, no diseases. How often do you need to have checkups for these conditions? So, between the ages of 19 to 39, I would recommend to check your blood pressure every 3 to 5 years when it's normal. Just when you're passing a pharmacy or if you're at the doctor's, just check your blood pressure. Often, one of our parents may have a blood pressure machine. Every 3 to 5 years, just checking on your blood pressure is probably enough. For cholesterol, every 3 years is probably good, especially when it's normal. For sugar and diabetes, every 3 years definitely should be fine when it's normal. From a dental point of view, once or twice a year for cleaning and checkups are recommended to pick up any cavities early enough. Eye tests, if your eyes are abnormal, then every 2 years you need to go and check if your prescription has changed. But if you otherwise don't need glasses, then usually every 5 to 10 years would be fine. If you notice that your vision isn't great, that's a time when you need to go and just do a quick eye test. Skin exam, it'd be good every 5 years to have a doctor just check on a few sun exposed areas to check if there's any abnormal skin lesions. You might want to do it a little bit more often if you are at risk, which means if you've had a family history of skin cancers or if you've had a lot of sun exposure, if your work requires you to work in the sun, like in construction or on a farm, for example, and you're in the sun all the time, it may be good to just check on your skin more regularly. In terms of having a full physical checkup, probably every 2 to 3 years in this age group is enough. And then infectious diseases. If you're particularly exposed, to STDs, sexually transmitted diseases, or TB, or some other tropical illness because you've traveled somewhere remote, then it'd be good to just do a screen for infectious diseases as well. And then other tests, if you have a particular family history for cancers or bleeding conditions or bleeding clotting disorders, then it'd be good to just do a check on that as well. Then the next age group is between 40 and 64 years of age. In this age group, one would want to do a few more regular checkups. So, blood pressure, assuming your blood pressure is normal, every year it would be good to just check on your blood pressure. Maybe more often if you're at risk of it, which means if you have a family history of it, if you have a high stressful job, you may want to check your blood pressure more than once a year. Cholesterol every 3 years is probably fine, but annual if you're at risk. At risk for cholesterol means if you have a high fat diet, a family history of a high cholesterol, or you probably have a little bit extra weight and you have a little bit of a high BMI, a little bit more on the obese side, then you probably need to check your cholesterol annually. Diabetes, sugar, every 3 years is fine, but annually if you're otherwise at risk. Colorectal cancer, this is a cancer that can happen, is probably the second most common cancer in males. Is from the age of 50 or 60, one would need to start doing some screening. We normally look at 50 for males and 60 for females. So, in the terms of this talk, 50 is probably enough. But from 45, if you have a family history of colorectal cancer, this is also something that is definitely age related, and you may have some sort of symptoms if you have any changes in bowel movements, more bleeding or darkening stools or constipation and diarrheas, for example, it may be good to just do a colorectal screen. And this may be as simple as a small stool test where they check for blood, or an actual scope where they go in with a camera to look for any suspicious lesions. Lung cancer, this is not an easy one to screen for, but if you have a smoking history of 20 years, heavy smoker, or previously you smoked for at least 15 years, it may not be a bad idea to check on your lungs once a year. And this can be done with a simple x ray to start with, and if there's anything suspicious, more um, invasive sort of checkups. The prostate, every 1 to 2 years is probably enough to do some tests until the age of 54, and then annually. This, of course, if you have a family history, which means a father or a brother with prostate cancer, you may need to definitely do this much earlier and much quicker, definitely annually. From a dental perspective, once or twice a year is enough to check still and clean your teeth. Eye tests every 3 years if you have good eyesight until the age of 54, but then annually, definitely, just to check on pressure changes and glaucomas and things like that. Skin exam, I would look at doing it more on an annual basis, especially if you've got skin damage or high sun exposed areas. Once again, if you have a lifestyle that has exposed you to a lot of sun from a work or leisure point of view, and you have suspicious skin lesions, you know, um, scaly areas or bumps that have been growing, it would be good to just check that on an annual basis with your doctor. Doing a physical exam is probably enough annually at this in this age group, so that would be good. And then other infectious diseases like the previous age group, depending on if you're exposed, it would be good to do a screen for that. And then other tests, other types of cancers, if you have a particular family history. Now, following these sort of recommendations, I think you would definitely be in good shape and prevent a lot of illness. And with that, I thank you.